By the time you watch this video, COVID-19 will be in your country. I've got two bits of good news, some bad news, and some really horrific news in relation to that. Let's start with the bad news. You are going to get COVID-19. You are. You've had flu, haven't you? At some stage in your life, you've had the flu. Everybody you know has had the flu. And COVID-19 is going to be like that. You are going to get COVID-19. There's a bit of good news there, and that is that for most people, it isn't even going to be as bad as the flu. For about 90% of people who get COVID-19, and again, just to tell you clearly, you will get COVID-19 sometime in the next year or two. Over the next 2 winter seasons, it will come to your house, there's no doubt. But it's not going to be, for 90% of people, it's not going to be something that is anything more than a bit of a temperature, a little bit of a cough in your chest. Some people are even recovering from it without medication, with just a little bit of rest. So for some people, it's even easier to recover from than the flu. For about 6 or 7% of people, it is going to be quite rough. It's going to be like a very, very bad flu. It probably will lead into pneumonia. You might even need a little bit of hospitalization, and you're going to feel rough for a few days. The problem with COVID-19, and this is the big issue, is that between 2 and 4%, we're not sure exactly yet. We might be able to bring that number down. It might go up. But somewhere between 2 and 4% of people will die. And this is the horrific news. And that is that it is the old people. It is people with weak immune systems, especially people who are compromised in their respiratory area, like I am. I have asthma, and so I am very much at risk of COVID-19 going further to complications like pneumonia and others. People are going to die of this. If you're old, if you've got a weak immune system, and let's be honest, if you're poor. If you're poor, you're going to be affected by this in two ways. One, you might not have access to medicines, you might not have access to hospitals. But it's not just access to medical help, it's also your life. You see, what I can do is if I fear I have COVID-19, I might want to self-quarantine myself for 2 weeks. That's the incubation period, 14 days, which is why it is more complicated than flu, which is only 4 days. But I can take myself out of the system. A lot of my work I can do. I can Skype into meetings. I can remote manage my team. I'm not going to lose a lot of productivity from self-quarantining, but you can't do that if you're poor. If you're on a minimum wage job, if you're a server in a restaurant or a security guard or a receptionist, you're not going to be able to self-quarantine. Even if you think you've got COVID-19, you can't take 2 weeks off. If you try and take 2 weeks off, you'll probably be fired and lose your job. So these people are going to stay in their jobs for no other reason than an economic reason. And that's going to create super spreaders, and it's really going to be a difficult thing. That's the horrific news. The good news is, the other second piece of good news, is that we can protect ourselves from this virus. As far as we can tell right now, it's not a majorly airborne virus. It's not just going to attack you as a virus from nowhere. Kind of really goes through our spit. So you're only going to get it if somebody coughs, and then you're in that area within the next sort of 10 or 20 minutes. So don't touch surfaces, because it'll sit there on surfaces. It gets onto your hands. You probably still won't get it, even if it's on your hands. You only get it if you touch your eyes or your mouth or your nose. So only if it starts to get into your system. So the good news here is that we can kind of put a layer of protection over ourselves. You will get COVID-19. I think I might have mentioned that. But we're trying to delay the number of people who get it so that our medical systems can prepare and develop their preparedness. We can have enough medicines and so on. And also so that we can give the scientists a lead time to get a vaccine. This time next year, we hopefully will have a vaccine, and that will help most of us. So for now, we're just trying to slow down the spread. And here's what you do. Wash your hands like you've got OCD. Wash your hands, and then wash them again later. Every time you go out, every opportunity you have, wash your hands. If you're in an office environment, put hand sanitizers and lotions that can help people sanitize their hands. Put them everywhere in every office. Don't touch things if you don't have to touch things. If you do have to touch a public thing, you're going to get coffee from the coffee machine. Wash your hands afterwards. Honestly, just wash your hands more. Then don't touch other people. So don't shake hands. Please, can we just stop shaking hands for now? We need to, in the next 2 weeks, shame everybody who tries to shake hands. If somebody tries to shake your hand, put your hand up and say, no, I'm not shaking hands. We're not even fist bumping. We're definitely not hugging and kissing cheeks. And if you see other people who are shaking hands, do what we do with smokers. If a smoker lights up in the restaurant next to you, you're going to say, hey, buddy, don't smoke here. Let's do that if we see other people shaking hands. We say, then guys, don't shake hands. We've just got to get out of this one very, very quickly. Maybe we all go a little bit Asian and greet each other with the hands together greeting. In workplaces, if you can encourage people to self-quarantine, if you feel you're getting symptoms, don't go to your doctor. You don't want to sit in your doctor's waiting room with these symptoms. Phone your doctor and ask where you can go for a COVID-19 test. If you do have to go out and you fear you might have it, then wear a mask. Those are the only people who should wear masks, is those people who fear they have the disease already and don't want to spread it. And then boost your immune system. Take vitamins, take immune boosters, get the flu shot. The last thing you want this winter is to get the flu and COVID-19 at the same time. That puts you in a high risk category. So get your flu shots. Keep yourself healthy. Do more exercise. Eat healthier. The healthy will survive. The young will survive. So no panic is the point of my message to you. Please don't panic. We don't need to panic. It is right that we're shutting down travel, we're avoiding public spaces right now at the start of this, because we're trying to just slow it down. We want to give our medical facilities, our medical systems, the best chance possible to prepare, and we want the vaccines to have the longest lead time they can so that we know they're effective. But you're going to get COVID-19 at some stage. So learn about the disease, know what it feels like, be able to self-diagnose it like you do with the flu. Hopefully you know that you have access to medication and healthcare if you need it. And then let's make sure that those countries that don't have national healthcare systems use this as an opportunity to rethink a national health system for their country, because you are only as protected as the least protected person in your community is. You only have as much immunity as the least protected person in your country has. So this is an opportunity for those of us richer, healthier people who have privilege to recognize that we're all in this together. And to help the poorest people in our communities to deal with this crisis that's coming their way. No panic, but lots of preparation, and a change is required in the way we engage with the world around us. I'm Graham Codrington. I'm from a company called Tomorrow Today Global. We're a group of futurists who look at the future, help people prepare for tomorrow's world today. COVID-19 just reminds us that tomorrow is here already.